Good morning. This is Dr. Bill White again, and I'm going to just talk to you this morning some about oxygen and its importance in orthodontics. It's important in life, and everything that we do is our understanding a little bit better about oxygen that we breathe. Our air is a certain percentage of oxygen, and we need that desperately. If we don't have it, we are gone in a very short time. So I'm going to just tell you some things that I've experienced during my lifetime about oxygen and what it does. Now, I am a mouth breather, and I have been here lately. I quit using my CPAP for a few days, and I just breathed on my own. And what happens, you stop breathing, or you just don't take in enough air to supply your body with the amount of oxygen you need. And this is very sensitive. If your kidneys detect that you're not getting enough oxygen in the blood system, they automatically shift over and go into high gear. In other words, they're pumping more than they normally should. They are working harder than they should. And this sends a message to the bone marrow. They produce a hormone or something that goes to the bone marrow. I don't know all of this. I'm just going to use regular language. I think people in general need to know this as much as the medical personnel that work on us need to know it. But the kidneys send the hormone to the bone marrow, which demands the bone marrow to produce more red blood cells so that we can get more oxygen to the body or to the muscles that need this oxygen to operate on. Now, I I'm a mouth breather, and I have a CPAP. So for a few nights there, I didn't use the CPAP. My nose stayed open, I breathed, I woke up, everything. But during the night, I had to get up and go urinate about 4 or 5, well, it was 4 times, and probably a 5th time. By the time I woke up, I had to go real bad. You have this urgent desire to urinate, which you've got to do in a hurry. You don't have enough, your mind can't cut it off that good. So I urinated about 5 times during the night and right after I woke up. And this kind of robs you of your sleep. You don't get enough sleep. And it also causes your mouth to dry out. You're breathing through your mouth a lot of times, not through your nose, and your mouth dries out, and you're sending dry air down into your lungs, which doesn't function near as good as the air that should go into the lungs. Should be moist to body. They should be humidified to where they don't dry your throat out, your lungs out. If you breathe through your mouth, it takes only about 15 minutes or so, and you'll feel like your tongue is leather in the back of your throat, and all the way down dries out your lungs, and it stops producing or stops the oxygen exchange from being as effective as it normally would. Breathing through your mouth, the air goes down slowly when you're just lying down. Now, when you're out here running or doing vigorous exercise, you're sucking like that. You're sucking all kind of junk down into your lungs, but you're putting a lot of air in there, at under pressure, and it goes out into the little alveoli, and you get more oxygen in your blood, and that's why you breathe like that when you're doing extreme exercise or just anything. You know, if you're running a race, I used to run track, and it would just, you couldn't get enough oxygen to your muscles and everything like that. So here during the night, I wasn't getting enough oxygen to my whole body, and so your kidneys go into high action, and they produce a lot more urine, and so you have to go to the bathroom more quickly, and during the night wakes you up and robs you of your sleep. I'm just beating around the bush here, but I want to get this across to just the general public. I mean, everybody ought to know about this. Now, this affects us. Let me give you if you breathe through your nose properly, you humidify the air. Your nose doesn't dry out like that, is like your mouth does. Your nose filters the air. It goes past a lot of little cilia that are moist, and they collect the junk that's in the air, or at least a lot of it, and they feed it back through your throat, and you swallow the stuff. It doesn't hurt your stomach, but it hurts your lungs if they go into your lungs. That you get this moisture in the lungs humidifying the air. It heats it up to body temperature, so your lungs don't take in this cold air. It takes in air that's heated up to body temperature. And these are things that the breathing through the nose does good for us. It does all these things. Plus, there's another good thing that it does. On the top of my head, I can't think of it right now, but I will later on. That's something that happens to you in there. But breathing through the nose is almost an essential thing for good health and everything. I had a young man in my practice years ago that was having lung problem, and he was having to take medication and seeing a doctor because of this lung condition that he had. This young man had been breathing through his mouth for a long time. If you breathe through your mouth, your tongue lies down in the lower arch. It is no way you could do it otherwise. I'm a mouth breather, and I know. And your tongue widens your lower arch out wider than it should be to meet the upper arch. Actually, the cusp on the upper arch should come over the lower arch and keep you from biting your cheek. Well, I bite my cheeks all the time. It's a problem like that. I'm a mouth breather, and my lower arch is wider than my upper arch, and it gives me a problem, and that's a problem you get from doing that. Now let's go back to this proper breathing. If we can actually breathe like we should. So we get this CPAP thing, which puts a little bit of air pressure, and it pushes the air into your nose, and you breathe it whether you want to or not, seems like. And so you get used to it. You get used to it till you didn't even realize it's up there. And it's helping you breathe, and this is sending more air into your lungs, pushing it out into the alveoli, where there's a good exchange of oxygen and CO2, and this is what we need. Now, last night I wore this CPAP, and I got to sleep with it late, and I slept the whole night through and never got up once to go to the bathroom. In fact, when I woke up in the morning, I didn't just need to jump out of bed and go to the bathroom all that quick. I did need to go there. So having the proper oxygen in the blood system kept me from having to do that. Now, why did it do that? If your kidneys can sense the oxygen level in your blood so quick, they immediately shift into high gear. They start pumping more, and they send out more CO2, and they try to get as much oxygen as they can, but they produce more urine, and you have to get up and go to the bathroom more. Now, I know this for a fact, that if you have a child that is wetting the bed, and we didn't understand this problem that we have here, we fuss at this kid, do all sorts of things, make him feel terrible, or he or she, and tell them they should quit this. And sometimes you get them to quit even though you don't get them to breathe right. But if you can get the child to breathe properly, where he's getting enough oxygen in his blood, they can stop wetting the bed. And the same thing is true with a grown person. If you don't get enough oxygen, you have to urinate a lot more. People that fly up high altitudes, they have to urinate more times than people that don't. In other words, anybody that gets a lowering of the oxygen in the blood, the kidney sense it almost immediately. The kidney sends out a hormone that goes to the bone marrow, and the bone marrow starts producing more red blood cells. So these people over in Nepal, or where the Himalayas are, they go there to climb the mountains. My son and daughter-in-law climbed the mountains there. They had to stay for several days or weeks for their blood, the blood cells increased enough to where they could hike up to a little over 17,000 feet. And that's almost impossible. If you were in an airplane and the airplane gets above 8,000 or 9,000 feet, you will start seeing a result of sickness from just not being able to get enough oxygen in your air. But on the mountainside, the only way I thought they got up to 17,000 feet without carrying extra oxygen is that the wind blows the air up the mountain, and it's carrying more oxygen than air would up in the air. If you're just flying up here and you're at 17,000 and they take the oxygen away from you, you're not going to last long. I mean, you'll pass out and die really pretty quick without the oxygen there. So these are things we know about oxygen. You've got to have it. Now, let's go into some other things that we do in orthodontics. I have scrubbed in on orthodontic cases, not all that much. I had some oral surgeons that really liked, they put up with me being a general dentist because I did good orthodontics, and they would do the cases that I had, and invited me one time to come in and just watch the case and do it. And I went in, a woman had a terrific problem. I mean, they reduced the maxilla. They took it down. She had too much height in this part of the face. Looked like this. She didn't have enough chin to make the face like. So they sectioned the maxilla loose. And the maxilla is lying down here on the tongue, and it's being held on by the tissue behind the maxilla, is supplying the blood supply to the maxilla. And they shorten the maxilla 10 millimeters and then put it back up in place and look at it. to try to reduce the height of this woman. Look down like this, and her chin was back here. And they asked, I remember the old surgeon looked at me, and I helped them wire this maxilla back. But maybe I shouldn't say that. But I could handle a wire quicker than some of the young men that were training to be old surgeons could do that. But I helped wire it back. And anyway, the surgeon was in charge of that, asked me how this looked. And I said, man, don't ask me. God only knows. I'm just praying that it'll grow back together. And it did grow back together. And it changed the whole looks of this woman. We gave her more chin. We advanced the pagonian down here. And she was just a totally different lady. But we worked on her from 7 in the morning till 1 o'clock that day, getting this face back. And the old surgeon took care of this person for about 2 to 3 weeks, and then they would send them back to you to finish your orthodontic work. In other words, you had some pre-surgical orthodontics to do, and then they would do the surgery, and then after the surgery, you went in and lined the teeth up and got the interdigitation and all the good things that we try to put on somebody's face and fixed her up that way. Well, the lady came in the office in about 3 weeks or so after the operation, and nobody in the office knew who she was. They were going to fill out some extra, you take her as a new patient. And she said, well, I'm this lady, and we couldn't believe. I mean, she looked so much better doing that. Her own child said, you don't look like my mommy. But she looked so much better that they didn't fuss about it. So this is happening, where you section all this out, take it out, put it back, and the blood supply to the tissue up there takes over again, and how this heals up in the blood vessels and the nerves and everything. It is a miracle to me how it does that. And so this is a very important part. Now, I had another patient that had maxillary surgery, and they took it apart, and the maxilla began to turn a little blue. It changed. You could tell it wasn't getting enough blood supply. So the surgeon had this lady put in an oxygen tank. It's a big tank with high oxygen level in it. I don't know whether it's pure oxygen, not, but it has a tremendous amount of oxygen in this tank. And she had to stay in there about a day and a half, and then the tissue turned back to regular, and she grew back fine by giving it more oxygen. In other words, she was just sitting in there where she couldn't hardly breathe without getting tremendous amount of oxygen to it. Now, they do this for different wounded people and things that are wrong, and they get better quicker. And this grew back in there. In other words, give the person more oxygen. And you see people whose lungs are not sufficiently working, and they're taking in oxygen to try to survive. So these things of needing oxygen are important for us to know. And as a layman or just anybody out there, if you aren't breathing properly, aren't getting enough oxygen, you'll be urinating more, your kidneys go into high gear. In other words, your kidney will be functioning twice as much as it should to take care of your needs, and you may wear itself out too soon, and that person may have to go through dialysis where they purify the blood every other day, and that is a pain, and I sure don't want to have to do that. So I want to continue wearing this CPAC and reduce the number of the work that the kidneys have to do. So I just wanted to sit down here a minute, and I'm not drawing or showing you any pictures. I have some pictures of surgical orthodontics, but not all that many. But to show you what actually can be done, but you've got to keep the oxygen level good, or it just doesn't work. Even animals learn that a tiger attacking a big animal like a buffalo or something goes to first and pinches the airway off of that tiger or that buffalo. And the animal killing that buffalo knows it fits and stay there just 2 or 3 minutes. This buffalo will stop moving. It'll die from a lack of oxygen. And human beings are the same way. And some people in the news have been shortening the air. It will take your life away from a person real quick. So we need oxygen, and do whatever is necessary to get the oxygen in there. Teach with the things that your nose does for the air is so much better. All the way it filters out the junk, and you swallow it, and it doesn't. This kid that I had problems with the lungs, and he was seeing a doctor for that. And I took it and widened the maxilla out and pushed the roots out there and increased the airway up here. That was the thing that was blocking the child's airway. And the kid did not have to go back to the lung person. He took care of himself, or nature took care of this. Nature cleaned the air going to the lungs, and he didn't have the problem that he was suffering with when he didn't have enough air. So you see children with underdeveloped maxillas. A child that, I know that nursing children develop the maxilla much better. I did all the orthodontics on a school in Africa. These kids lived in this village. They all did the same thing. They nursed for about 2.5 years, and they had maxillas that were developed fully. You can't nurse and breathe through your mouth. So they were forced to breathe through the mouth. The kids back in the bush country like that had to nurse for about 2.5 years to get enough protein to continue living. So the ones that didn't get it got a disease called kwashiorkor, that they grew huge stomachs and they died. They just didn't live. They called it the younger baby killing the older one. If the mother had a child within a year or so of having another one, they didn't live. So these are some things that oxygen does for us, and we all need it, and we all have to get it, or we just can't exist on this planet.